Welcome to this video focused on the anatomy and physiology of the endocrine system, specifically designed for exam preparation like NORET, RRB, ESIC, DMER, and DHS. Let's compare the nervous and endocrine systems. The nervous system uses fast, electrical signals via nerves, while the endocrine system uses slow, long-lasting chemical signals or hormones broadcast through the bloodstream. The endocrine glands are distributed throughout the body. Cranial glands include the hypothalamus, pituitary, and pineal. The thymus is in the thorax. Adrenals and pancreas are abdominal, and ovaries or testes are pelvic. Hormones are classified into steroids, which are lipid-soluble and made from cholesterol, and peptides, which are water-soluble and made of amino acids. Steroids cross cell membranes easily, while peptides use surface receptors. The mechanism of action is a key exam concept. Steroid hormones use direct gene activation, resulting in a slower but longer effect. Protein hormones use the second messenger system, such as CAMP, for a faster effect. Negative feedback loops are the most common, reversing the original stimulus, like insulin-lowering blood sugar. Positive feedback is rare, where the response strengthens the stimulus, as seen with oxytocin during labor. The hypothalamus is the commander, linking the nervous and endocrine systems. It produces releasing hormones like GHRH, TRH, CRH, and GnRH, which target the anterior pituitary. The pituitary gland, or hypophysis, is located in the sella turcica. The anterior lobe is glandular tissue, making its own hormones. The posterior lobe is nervous tissue that stores hormones made by the hypothalamus. The anterior pituitary hormones can be remembered with the mnemonic flat peg. They include hormones for growth, reproduction, and metabolic functions, targeting bones, muscles, gonads, the thyroid, and adrenals. Growth hormone, or somatotropin, targets bones and skeletal muscles to promote protein synthesis and fat breakdown. Clinically, it has a diabetogenic effect, raising blood glucose. Hypersecretion leads to gigantism or acromegaly. Gigantism is excess GH in childhood, resulting in tall stature. Acromegaly is excess GH in adulthood, leading to thick bones, large hands/feet, and prognathism, often caused by a pituitary adenoma. Let's review an exam question. Hypersecretion of growth hormone in an adult patient leads to which condition? The correct answer is B, acromegaly, because the epiphyseal plates are fused in adults. Prolactin stimulates milk production, and hyperprolactinemia can cause galactorrhea. Gonadotropins, FSH and LH, regulate egg/sperm development and trigger ovulation and testosterone production. The posterior pituitary stores ADH, or vasopressin, which targets the kidneys to reabsorb water and decrease urine output. It also stores oxytocin, which stimulates uterine contractions and milk ejection. Diabetes insipidus, or DI, is caused by low ADH, leading to high dilute urine output, hypernatremia, and dehydration. SIADH, or high ADH, causes low concentrated urine, hyponatremia, edema, and confusion. Consider this question. A patient post-craniotomy develops urine output of 400 milliliters per hour with a specific gravity of 1.002. Which condition is suspected? This large volume of dilute urine indicates C, diabetes insipidus. Quick check. Which hormone is known as the milk ejection hormone? The answer is oxytocin. The thyroid gland is in the anterior neck. It has two lobes connected by an isthmus. Follicular cells produce T3 and T4, while parafollicular C cells produce calcitonin. T3 and T4 are the engine of the body. They regulate the basal metabolic rate and increase body heat. They are essential for infant brain development, and iodine is mandatory for their synthesis. Hypothyroidism, or myxedema, is slow and cold, often caused by Hashimoto's or iodine deficiency. Signs include weight gain, fatigue, cold intolerance, bradycardia, dry skin, and hair loss. Treatment involves levothyroxine. Hyperthyroidism, commonly Graves' disease, is fast and hot. Signs include weight loss, heat intolerance, tachycardia, and tremors. Graves' triad includes goiter, exophthalmos, and pretibial myxedema. Thyroid storm is a thyrotoxic crisis triggered by stress or infection, presenting with high fever, severe tachycardia, and agitation. Management priorities are maintaining the airway, beta blockers, antithyroids, and cooling without aspirin. In post-op care following a thyroidectomy, Which equipment is most critical to keep at the bedside? The primary concern for airway compromise makes B, tracheostomy set, the most critical equipment. Quick check. What is the specific sign of Graves' disease involving the eyes? The answer is exophthalmos, or bulging eyes. The 4 small parathyroid glands, located on the posterior thyroid, secrete PTH, which increases serum calcium by pulling it from bone and increasing gut absorption. Calcitonin is its antagonist. Hypoparathyroidism leads to hypocalcemia, which presents with signs of tetany. These include numbness around the mouth, Chvostek's sign, and Trousseau's sign. The major risk is laryngospasm. The nurse observes carpal spasm when the blood pressure cuff is inflated. This is known as, B, Trousseau's sign, a classic indicator of hypocalcemia. The adrenal glands are suprarenal, sitting on top of the kidneys. The cortex, or outer layer, secretes steroid hormones, including aldosterone, cortisol, and androgens. The medulla, or inner layer, secretes epinephrine and norepinephrine. The adrenal cortex hormones are remembered as salt, sugar, sex. Aldosterone, a mineralocorticoid, retains sodium and water. Cortisol, a glucocorticoid, is anti-inflammatory and raises blood sugar. Androgens regulate secondary sex characteristics. Cushing's syndrome is hypercortisolism, or high cortisol, often caused by steroid therapy or a tumor. Signs include moon face, buffalo hump, truncal obesity, and purple striae. Labs show hyperglycemia, hypernatremia, and hypokalemia. Addison's disease is adrenal insufficiency, a lack of cortisol and aldosterone. Signs include bronze skin hyperpigmentation, weakness, and weight loss. Labs show hypoglycemia, hyponatremia, and hyperkalemia. Which electrolyte imbalance is a priority concern in a patient with Addison's disease? Due to the lack of aldosterone, potassium is retained, making C, hyperkalemia, the priority concern. Pheochromocytoma is a tumor of the adrenal medulla, causing excess catecholamines. The classic triad includes severe headache, palpitations, and profuse sweating. Diagnosis uses a 24-hour urine VMA test. Do not perform abdominal palpation. Quick check. What is the hallmark electrolyte imbalance in Cushing's syndrome? The answer is hypernatremia, due to the high mineralocorticoid effect. The pancreas's islets of Langerhans contain alpha cells that secrete glucagon, which raises blood sugar, and beta cells that secrete insulin, which lowers blood sugar by pushing glucose into cells. Type 1 diabetes mellitus, or IDDM, is juvenile onset with 0% insulin due to beta cell destruction and risks DKA. Type 2, or NIDDM, is adult onset caused by insulin resistance, often linked to obesity, and risks HHS. Comparing the acute complications of DKA and HHS is crucial. DKA involves ketoacidosis, typically in type 1, while HHS involves extreme hyperglycemia and dehydration, typically in type 2. Which respiratory pattern is characteristic of diabetic ketoacidosis? The body attempts to correct acidosis with deep, rapid breathing known as B, Kussmaul's respiration. Priority nursing interventions for DKA and HHS include hydration with 0.9% normal saline, IV regular insulin infusion, monitoring and replacing potassium, and hourly blood glucose checks. Insulin is administered via the subcutaneous route. The best absorption site is the abdomen. When mixing insulin, remember, clear before cloudy. Open vials can be stored at room temperature for 28 days. When mixing regular or clear and NPH or cloudy insulin, the nurse must draw the regular insulin first. Therefore, B, draw regular first, is the correct answer. The pineal gland secretes melatonin, which regulates the circadian rhythm, or the sleep-wake cycle. The thymus gland secretes thymosin, which is essential for the maturation of T lymphocytes for immunity, and atrophies after puberty. Which hormone is responsible for regulating the sleep-wake cycle? The correct answer is B, melatonin, which is secreted by the pineal gland. Let's review some high-yield concepts. DI involves polyuria and low ADH. SIADH involves oliguria and high ADH. Graves is hyperthyroidism with exophthalmos. Tetany is from hypocalcemia. Addison's presents with bronze skin and hyperkalemia, and DKA involves ketones, acidosis, and Kussmaul respirations.